Now we're ready to take a look at the bones. To do this, I like to have my axial view on the left, and then I like to start with the sagittal view on the right. Both are on the bone window. And also for the axials, generally speaking, if you have a bone kernel or really small slice thicknesses, these are 0.625 millimeters, this will be advantageous for looking at bone pathology. So I recommend trying to use the bone kernel if you have it in your protocol, or the thinnest slices that you can for looking at the bone. So what you can do, I just start midline looking at the spine, and I split it up into two sections, kind of anterior spine versus posterior spine. So I start with the anterior spine looking at the vertebral bodies and then also the pedicles. So we can just scan down through the anterior spine here and just take a look, vertebral body, pedicles here, and just make sure that there are no suspicious lesions, that there are no fractures through the vertebral body or the pedicles. And here we see these sclerotic lesions. For our purposes, for this particular patient, these have been stable, so they're not suspicious. And then here we have, we'll kind of co-localize here, but here we have a Schmorl's node. So again, not of clinical significance. So we'll blow past some of these things. So we just look through, but again, you see that there are these sclerotic lesions. There are these Schmorl's nodes that you see when you're looking kind of at the anterior spine. Again, for our purposes, these are not suspicious, so not something we're concerned about, but it's important to notice that this is where some pathology is. So we just look through the anterior spine all the way to our lowest level here. And now as we go back up, we're going to look at more at the posterior spine. So this includes looking at the transverse processes, looking at the spinous process, the facet joints, the lamina. So now we'll just kind of scan up, taking a look at the rest of our posterior spine. Again, making sure no suspicious lesions, no fractures, that the facet joint spacing and alignment looks okay. And we'll come up all the way as high as we can. And we can clear the spine here for this study. Now, we're in a position to take a look at the ribs. It can be a little tricky, but what you want to do is see where the first rib comes off right here. So this will tell you that this is T1. And if you want, you can kind of corroborate that here too. So right there, this is our T1 level. So this is helpful for when you're counting ribs or counting vertebral bodies. So we'll start with the right side. And there's a few different ways that you can look at ribs. You can trace each one individually, or if you want, you can kind of split things into quadrants. So what generally can be useful is maybe splitting into quadrants so you can go a little bit more quickly, unless you're very, very concerned about rib pathology, in which case you may want to just trace each one individually. So what we can do is kind of look at the posterior aspect here as these ribs come off, and just take a look back here and see if are there any fractures, and you can kind of go back and forth, is there any suspicious lesions? And we'll go all the way down, just kind of looking again, kind of at the posterior quadrant here, or region here, as the ribs come off the vertebral bodies. And then we can look more laterally. We go all the way down, come back up, look kind of here, and see if as the ribs come into that area that we're scanning, is there any abnormal pathology? And then we can look anterior, kind of here, as the ribs come around to the sternum, and just see, are there any lesions, fractures? And we can go up and down to look there. And then we'll do the same thing on the other side. We can come up to the beginning, look at the posterior aspect. Is there any pathology, anything unusual? And again, you can always go back and forth if anything catches your eye. Look at the lateral aspect. And then we'll look at the anterior aspect and see, is there anything unusual? Okay. And once we've done that, what we can do is we've done the spine and the ribs. I just like to start at the right. If you catch the humeral head, you can just look at the humerus here. We'll just scan up and down, looking at the humerus right here. Make sure there's nothing there. Then we can pretty naturally transition to the right scapula. And we can go all the way down. It can be easy to miss scapular fractures or pathology because we may not always think to look at the whole scapula, but we can go up and down and look at that. And then very easily what we can do is, here's our clavicle that's coming off. So we can just follow it all the way to the sternum, clear the clavicle. Now we can naturally go to the sternum and we can start at the top and work our way down, looking for anything in the sternum. Down all the way through, go back up. Now we can go to the left clavicle. There you go. We'll follow it back here as best as we can to the left scapula. And we can look through the entire scapula, make sure there's no fracture. Nothing unusual there. Then we'll come back and we'll end with the left humeral head and just make sure that that looks okay. Now what we can do is go to our sagittal, and here we can get a really good sense of the alignment and make sure there's nothing unusual. We see some of the same sclerotic lesions, the Schmorl's node, that's right here, another sclerotic lesion. These are probably bone islands. So we can just scan through. We can also look at all the facet joints on our sagittal view as well too, make sure that there's nothing unusual with the alignment here. So this can be very, very helpful. And then similarly, the sternum actually is a little bit better or easier to appreciate on this view as well too. So you can just look at the anterior bones there, like the sternum, make sure there's no fracture. And when we feel good about looking through the sagittal and we're comfortable with the alignment, we can just go quickly to the coronal view. And this can give you some helpful orientation with looking at kind of the alignment of the spine in this dimension. Kind of scroll through, again, looking for pathology, any gross malalignment. Some things like, maybe these scapulas can be a little bit easier to appreciate if there is a fracture. So it's just helpful, especially for the bones, to look at things in multiple orientations, as it really helps kind of appreciate if there is any malalignment or pathology. But that's actually a very thorough approach to the bones. As you do it more, you'll get more comfortable. But this just kind of breaks it down. So this was a look at the bones and pretty much all the different orientations. And once you've done all of that, you're ready to move on.